Well, I think we'll get started. Thanks so much for taking the time to join me today. For those of you who don't know me, my name is Erin Ann Kalkis, and I head up insurance sales here at CBIA. I appreciate how many of you are here to learn about our level funded product. Many of you joined me back in September when we initially launched. And look, we know that launching a product that late in September was not ideal. But to those of you who brought us new business during that crazy time of year, thank you. Thank you for trusting us with your clients. After enrolling hundreds of employees over the past few months, we're even more confident that CBIA has a solution for Connecticut businesses who are struggling with their healthcare options now. This is a solution for you as consultants to bring something different to your clients. This is not your average mid to large market level funded product. This product was built around flattening the cost curves, helping members become consumers of healthcare, and saving the member and the employer plan money. This morning, I'll take about 20 to 25 minutes to review the product in detail, introduce you to the programming, show you where you can find additional information on our website, and answer your questions. Please feel free to jot down your questions in the Q&A area at the bottom of your screen. And at the end of my presentation, Lynn Sorrentino will help us get your questions answered. This presentation is being recorded, and it will be sent out to you in the next few days. So are we ready? Let's get into it. So as I said, this is a level funded product. It is exclusive to CBI members with 10 or more enrolled employees. But important to note is that there is no ceiling on this product. In fact, many of the groups that we've written over the past few months have been in the 80 to 120 life range. So certainly a product that hits the middle, but moves us up market for some larger group opportunities. We are returning 100% of the surplus back to employers. Frankly, it's just not our money. It's not our money to keep. There is no requirement for mandatory life. There is no need to be a Connecticut headquartered company, though we do need to have at least one Connecticut location. We have a 25,000 ISL and 120% ag. That is standard on all proposals. Also standard is a $40 PEPM commission, although you can adjust that commission piece up if you need to. But essentially what we've done and why we're different is that we broke apart all of the traditional pieces of medical insurance and put them back together with best-in-class vendors from around the country who have been successful in holding down costs and utilization in other markets. These vendors are built around transparency. They do things differently, and they bring solutions that make this product unique. Remember, this product is about predictability and stability. Valence Health and NavCare is our member services vendor. Ventegra, our pharmacy benefits manager. Recuro Health does our virtual care. Our TPA is SNS Health, who also brings us the Cigna network, as well as the Healthcare Blue Book transparency tool. And our stop loss provider is Skyward Specialty Insurance. I'm going to spend, the next few minutes reviewing this solution stack of vendors with you, introducing you to why they're unique, and some of them I believe will be new to you. Up first is Valence Health. Valence Health brings us a concierge level member services with their NavCare platform. We've received many compliments from enrolled members who have called NavCare. NavCare answers the phone live. They speak human. They engage the member, who ultimately feels heard and taken care of. And members become better consumers through their high-touch navigation, their support for claims and benefits, for being connected to other vendors in the program, including pharmacy. And they also work with the member and providers on care coordination and disease management. And Valence provides a low or no-cost alternative to high-cost advanced imaging facilities through a preferred independent network. Members call NavCare when their doctors prescribe an MRI or CAT scan or the like. NavCare will connect them to a facility close to where they work or live, make the appointment with them on the line, and even set up the payment so that the member just has to show up. No waiting on prior authorizations, no mandated physical therapy first. If the provider prescribes it, they can have it done quickly by calling NavCare. And it may cost them nothing, or if they're enrolled in an HSA plan, less to nothing due to the discounts that Valence has in place. Encouraging members to use this service and to be good consumers of healthcare saves the member's wallet and the employer plan. Ventegra is our pharmacy benefits manager. They are a non-for-profit, independent pharmacy benefits manager that delivers transparent, cost-effective solutions. Let me say that again. They are a not-for-profit, independent PBM. That in of itself is truly unique. How else are they different? Well, most PBMs use what's called an average wholesale price. This benchmark has been used for over 4 decades to determine pricing and reimbursement of prescription drugs to third parties, but it's an old model. Ventegra uses a model called cost plus, and this means paying the pharmacies weekly for the actual market cost of the drug plus a dispensing fee. The market cost is updated every 24 hours to get the best price at all times. By switching from average wholesale to cost plus, Ventegra is able to cut 20 to 25% out of the employer plan utilization for high-cost drugs. In fact, a locked-in study showed that in 2023, the average industry cost of a prescription drug to the plan by member by month was $131. $131 per member per month in pharmacy hits to an employer plan. Ventegra's average for that same time frame using those same drugs, $82. That's a huge difference. Clients don't need to choose one pharmacy or another. Ventegra doesn't own any mail order company or specialty pharmacy. There are no conflicts of interest. They are independent and transparent, and they work for patients and the plan. I want to note that all available rebates will be given back to the employer. And if you know how this industry works, that's pretty unusual. But dollars will actually flow back to the employer via their claim fund or by paying back stop-loss hits. And Ventegra will work with benefit preservation programs to find manufacturing discounts and coupons for members who qualify. They have a strategic focus on the 2% of members who drive 50% of the claims. And so they work with the patient and providers to provide lower cost alternatives, such as biosimilars, instead of just deferring to the high cost drugs. And every time they are helping the employer plan save. We chose Costco for mail order services, no membership required, and Paragon 360 for specialty drug management and delivery. SNS is our TPA service, and they are essentially the TPA to TPAs. They've been working behind the scenes for close to 30 years as the backroom engine for some of the country's largest third-party administrators. They have over 500,000 members that they've helped with claim management, end-to-end support, and solutions to lower healthcare spending. They bring full integration with the CBIA program for seamless member experiences. They have an online member portal called HealthX, where ID cards, claim information, the Cigna network can be viewed, as well as access to Healthcare Blue Book for price transparency and informed decisions. Speaking of Healthcare Blue Book, if you've never worked with them before, they're kind of like using Kelley Blue Book when you need to buy or sell a used car. Using an easy-to-identify system, Healthcare Blue Book ranks providers with green, yellow, or red to indicate cost and quality. It helps members navigate to the highest quality provider for their unique needs. It includes more than 4,000 facilities and 500,000 providers, offers quality rankings for more than 200 procedures. Employees can view provider-specific ratings, patient reviews, and general practice information, and it satisfies the fiduciary obligation under transparency rules for employers. On the right-hand side, you'll see an example of a Healthcare Blue Book screenshot showing a knee replacement surgery. The total cost is around $34,000, but you can tell by looking at the reds and the greens and the yellows that the cost and quality of this procedure is kind of all over the place. What we want to do is steer members to the best outcome at the lowest cost. It helps them understand healthcare's wide ranges of care and cost. We want them to stick with green and stay away from the red. Recuro is an integrated digital healthcare solutions company that takes a uniquely personalized and proactive approach to virtual care. More than the average telephonic solution, these are board-certified providers who will establish a working relationship with patients just like an in-person visit, but at a time that's convenient to the member with much lower cost. Recuro's core virtual care offerings include primary care and behavioral health, which solves an access issue Connecticut is facing right now. As you know, it's almost impossible to find a PCP or behavioral health practitioners who are accepting new patients and can be seen quickly. Recuro is committed to providing the tools to help patients proactively manage their health and maintain their well-being on an ongoing basis. They have a 92% satisfaction rating, and they were named among the world's best digital healthcare companies in 2024. Skyward Specialty Insurance is our stop-loss vendor. They've been rated A, excellent by AM Best. We have a dedicated underwriting team to customize our risk and to understand the groups and price risk appropriately. They create opportunities for us by using a proprietary underwriting tool, using claims data, same kinds of tools that others are using. And they're great to work with. So normally you would get all these services provided under one roof by one carrier with one member services number for members to call. And even though there are many vendors as part of this solution stack, I want to assure you and allay any fears, there are still few points of access. Nobody needs to be worried about calling all of the vendors one by one to solve any problems or concerns. Employers will still call CBIA to handle any of their eligibility, enrollment, or billing concerns. Employees will call one number, NavCare. They'll get member care, care coordination, navigation, and integration with all of these other vendors. One number for employers, one number for members, and for you. Well, look, you guys have been working with us for years, and you know how hard we work to support you. Our benefit portfolio is pretty simple, not pages and pages of different plan designs that you have to hunt and peck to try to understand the differences between. We have 6 carefully picked among the most popular plan designs in the market, 3 HSA and 3 more traditional copay deductible kinds of plans. Access to Cigna's national PPO network. a 4-tier preferred formulary with MAC A pricing. Recuro offers $0 copay for those virtual services that I mentioned, primary care visits, urgent care, and behavioral health. And Valence offers us those cost savings with access to the preferred network of independent facilities. Agent resources. So here's where I mentioned I'm going to hop out to the website and just show you where you can find some additional information. So here you go to the CBIA website, go to insurance, and find agents. Click on product resources. Medical is the top topic here, where you can find agent information, brochures, our forms. A pretty robust employee participant information area that gives links, the customer service number for NavCare, links to the pharmacy, different formularies, the provider directory, healthcare blue book, and the like, but also employee-focused flyers that help members really understand the services and the providers that are working on their behalf. We also have plan summaries and SBCs. But I would also be remiss if I didn't mention the full portfolio of non-medical benefits that you can learn about on this page as well. Remember, CBIA Health Connections is a full portfolio of employee benefits. It's not just medical. I also wanted to mention that we're working with DocuSign to integrate all of the vendor service agreements, BAAs, plan documents, etc., into one package, making installation faster and easier. And that'll be up and running for 5/1 effective dates. So how to get a proposal? We have a dedicated sales team that is working the proposal queue. The email that you would send your request for proposals is hcsales@cbia.com. And basically, we just need you to send all the same information that you're used to sending, right? So it's the group information, full census, including the kind of plan that subscribers are enrolled in if the group is offering more than one. We need plan summaries, schedules of benefits, renewals, and if it's level or self-funded, we need at least 9 months of paid claim services. I'm sorry, paid claim experience. And here's my little spin on FAQs for the proposal. You use your best known census. So what that means is if you've known your client for a pretty long time and you know that Jane Doe never enrolls, then keep her as a waiver. Waivers will not be underwritten, but not all who are underwritten must enroll. All who enroll must be underwritten. And what I mean by that is if you think there's a chance that someone who has previously waived, or maybe even a new hire who has waived, you may want to include them in on the census to get underwritten. There are no IMQs required unless someone presents at time of enrollment, installation that has not been underwritten, then we'll request an IMQ. Our proposals include 4-tier composite rating, and our sales team turns around these proposals in about 5 to 7 business days, unless the submission is not complete or there's wicked high volumes. So again, the program and review. While you're looking at this, I do want to talk about pricing and set a little bit of an expectation for you. We are competitive. We're very competitive on the right groups. We aren't buying business or underpricing the risk to win the business. We are pricing appropriately for the risk. I can tell you that our average savings on the groups that we've sold so far has been between 14 and 21% off renewal. Listen, your clients have the right to enroll in a product that defies to actually work for them. If you're happy with the way things are going in today's market, with less competition, little transparency, and rising costs, then that's fine. Keep doing what you're doing. But if you want to see things here change in Connecticut, where you and your families live and work, where some of you run your own businesses, if you want to see change, we need you to support this product. We have a real opportunity to create change together. All right, now it's time for the Q&A. Lynn, do you have any for me?
Yeah, we have a few questions. So the first one, can the Connecticut location requirement be satisfied by one remote employee? And I think what Bob is asking is the difference between perhaps a remote employee that happens to reside in Connecticut versus an actual Connecticut location.
Yeah, we do get that question a lot. I like to kind of say, look, if there is somebody who is working remotely for a New York or a Massachusetts company, they're not really a full-on location. It's really a standard location with their own mailbox, their own brick and mortar, a real separate, sort of building, if you will.
Okay, thank you. The next question is, if a member does not use, I guess it's, what happens if a member doesn't use Ventegra?
If they don't use Ventegra, then it would be like just paying completely out of pocket. You wouldn't be getting the benefit of the savings through the pharmacy benefits manager. It would be like just choosing to not use your insurance.
Mm-hmm. Okay, the next question is, are there any MEC plan offerings? So add-ons for companies who might have, say, a larger employee base and they don't want to offer a full medical plan.
No, this is our medical plan offering. This is it. And it matches it. It really matches right up alongside of the kinds of things that are out there in the market today, but we're treating members differently. We're trying to engage members differently. And these things they're not roadblocks, right? They're more like speed bumps. So we're not enforcing that every time somebody, gets an MRI prescribed for them, that they must call Valence. They must get in touch with NavCare. They don't have to. They can go anywhere they want to. But it's going to cost them more money, and it's going to hit the employer plan with a higher dollar value. And that's what we're trying to keep down. So catastrophic, anything like that, any other plan designs that are out there, that's not what we're after.
Okay. Are the virtual visits also no copay for HSA plan members?
So it's no copay, of course, but there is, the front end deductible that would have to be met before you get to that point. So it would be first dollar on HSA.
Mm-hmm.
And we can find out what that cost would be for the providers.
Okay, the next question is there a rolling effective date, or will all employers need to change to a certain date?
Oh, no, it is every single month. So we are open for business every month. Send in your proposals, rolling effective dates for full 12 months throughout the calendar year.
Mm-hmm. Is this product available for employers with less than 10 employees?
Unfortunately, no. And I know that that kind of hurts, right? Because look, the small business, the small market is not in a great place. And we're trying to work with the legislature to try to create opportunities for the smallest of groups. Unfortunately, the stop loss carrier that we work with, like they had a hard time getting us below 20. We worked really hard to get them down to 10, but unfortunately that is the bottom. That's as low as we can go.
Okay, the next question is, how will the renewals be calculated? So what happens if claim experience is running hotter than anticipated?
Right. So, every group just, just like your average level funded product, right? Every group is rated on their own, although there will be sort of an eye to the block. And so hopefully the block as a whole is running well enough to try to help some of the groups that may not be running as well. But yeah, I mean, if a group is not running as well as we would have liked or as we would have anticipated, you might see some higher renewal numbers. Although I think you'll see in the programming that if the employer and the employees are engaged, the renewal action wouldn't have been as high as if they had stayed in the traditional carrier path through level funding. Those carriers don't have the kind of mechanisms in place that we have to hold those costs down. Obviously, employee member engagement is key here.
Okay. Erin, does the stop loss contract have a no laser provision?
There is no lasering.
Okay, good. And what about, are there any second year rate caps?
Second year rate. I'm sorry, repeat?
Yeah, there was a question about, are there any second year rate caps?
Oh, not at this point. No, we haven't gotten that far into sort of solidifying what our second year business is going to look like. Coming up soon though, for sure, as we wrote our first group in October. So that'll certainly be something that we'll be working with our stop loss carrier on. And yeah, as soon as we find out what our strategy is, we can have one-on-one conversations with those groups, with the agents and those groups.
If a company leaves the plan on renewal, will the claim fund be forfeited?
So if the company leaves on renewal, again, it's their money. We will not keep it. So if they are in a surplus position, they will get back 100% of the surplus that they are owed. It's not our money to keep.
Okay. Erin, what is this product actually called?
Aaron's fabulous product. We don't have a kind of swanky marketing name for it. It's basically the CBIA level funded medical product as part of the Health Connections portfolio. Just rolls right off your tongue.
All right. And how will any pending Connecticut legislation on level funded rates potentially affect this plan?
Yeah, that'll be interesting. I mean, obviously the bills that are up right now are dangerous and they're really going to affect the market completely. So yeah, whether it's our product or any of the other products that are out there, I think everybody will have to take a good look at how they can move forward given the enhanced or the greater attachment points that are being proposed. What we have heard is that we do believe that it will come out of committee for a vote at the General Assembly level. But there's some mixed feelings as to whether or not the General Assembly will actually vote it in.
Okay. Erin, what are some of the challenges that we're seeing?
I would say there are large carriers out there who are buying business. They are using smoke and mirrors in terms of sort of their transition credits. They'll offer big credits at the front end and then take 60% of the surplus on the back end. They don't always, reissue pharmacy refunds back to the employer. We're doing all of those things. We are not a national carrier. We're a business association, and we're doing what we feel is right for businesses in Connecticut.
Erin, if someone missed the beginning of the presentation, is this recorded?
This presentation is recorded and it will be sent out to all registrants in the coming days.
All right. Are there employee participation requirements and what is the largest group size allowable?
Well, really, as I mentioned earlier in the presentation, there is no ceiling. I mean, if you want to send in, and we've received proposals for a couple of hundred live groups. The participation requirements are, 50% of all eligible employees after spousal waivers, down to a minimum of 10 enrolled. But in terms of the cap, I mean, naturally, at some point, the groups will just move to a fully self-funded kind of arrangement. They get large enough to be able to absorb those kinds of ebbs and flows of claim activity. But again, we have no cap. I would say that our target market is probably between, 20 and 150 to 200 lives.
Okay. Erin, can you speak a little bit about prescription rebates? So pharmacy rebates, how they work?
Yeah, so pharmacy rebates they take a little bit of time, but they will flow back to the employer within about 6 months. Pardon me, they'll flow back to the employer into their claim fund as an added balance, unless there's been a hit to stop loss. And then those dollars will begin to help pay off that stop loss hit. Either way, it benefits the employer's plan, because if there is a lower stop loss hit or more money in the claim fund, obviously there's more opportunity for a bigger surplus and a smaller renewal. So again, everything we're doing is to benefit the employer and the members.
Okay. So this is an underwriting question. If the employee, if the change in census varies by greater than X, what threshold would require or trigger a requote? So
That's an interesting question. The stop loss carrier that we have is pretty, Skyward is pretty liberal in that. I mean, they're not gonna sort of requote for one additional life, especially if the IMQ that we will require for all people who have not been underwritten. If the IMQs come back clean, virtually there will be no change. Obviously, if IMQs or if there's something that presents that we weren't aware of, whether it's one person or 5 people on a 20 life group or a 12 life group, there is an opportunity for repricing. It really is based on the risk, not about the sort of 10% or 20% threshold.
and I know you spoke about the stop loss the stop loss rules or format, if you will, but what is the run out period? Can you speak a little bit about the runoff?
Right. So the contract is a 12-15, and it is a gapless renewal. So it runs right into next year's renewal. But it is a 12-15. So if a group were to leave, and claims flowed in after the 15th month, they would be responsible for those.
Okay. And we're getting questions through a couple of different places through chat and Q&A. What is the timing? And I think you covered this, but what is the timing for the surplus payout, assuming there will be one?
Yeah, so because there's that 3-month run out, so you've got your renewal, then 3 months, getting to that 15th month, the checks will go out on like the 17th month, right? So we'll have the 16th month to sort of report and settle, and then checks will go out a couple of weeks after that.
Okay. Can you speak a little bit about benefit exclusions?
Yeah. So, benefit exclusions, they are also on our website under the plan summary page. They're right in line with where the market is. I know the one thing that people ask about is infertility. We will not cover infertility. That is an exclusion. Everything else, the hearing aids, the TMJ, all of those other things that all of the other players in the market exclude, we exclude them as well.
Okay. So Erin, one of the slides said that waivers are not underwritten, and yet it was just mentioned that IMQs are required for anyone added at open enrollment who was not underwritten. So can you clarify, please?
Sure. So yeah, that I know I kind of was confusing on that slide. If we think about the best known census, right? So if there is any opportunity for a waiver, somebody that's waived for a couple of years, if there's any opportunity that they may want to jump on the plan, I would not mark them as waived, right? If, however, take me for example, my husband's a retired state trooper. Many of you know that. I've had state insurance my whole life. I'm never coming off of that plan. And so, CBIA would keep me as a waiver. There's no opportunity that I would hop off and jump on the group plan, barring some, qualifying event. So if, however, you did include someone who was waived on the census, that means they are not underwritten and they present at installation. So their enrollment form comes in along with everybody else's. We do an audit. And if someone presents having not been underwritten, we will require the IMQ at that point. Up until that point, that quote is a fully baked in quote. It is not illustrative. Those are the numbers you can use. Again, as I mentioned, it's unlikely that if that IMQ is clean, that there would be any change to the rate. But there is an opportunity to miss somebody or a new hire comes on since the time that you've issued the proposal. A lot of situations where a person may not have been underwritten. And this also includes dependents. And so that's the point that we would require an IMQ just to make sure that we're keeping the plan and the product, safe from high risks.
Yep, and I just want to make sure we answer that question to that, for that inquiry. It's a difference between perhaps new business. So we're using the term, open enrollment, but it's new business
Yes,
as opposed to someone
throughout the year.
on throughout the year for a qualifying event. And I think
Absolutely.
that-
Sorry.
Very
Thank you
helpful.
for
So
clarifying.
we hit that. Yeah. Yep. No
Yeah.
problem.
Yep. So
Um,
throughout the year, and at renewal, there won't be any need for IMQs. It's only at the initial proposal and initial installation.
Great. Thank you for clarifying. And then can you just speak a little bit about case installation? So timing of new business.
Yeah. So setting December and January aside, right? Because those months are and were crazy. So for the other 12 or 10 months of the year, I would say that if we receive the participation agreement in and all necessary documents by the 15th of the month, I know, but by the 15th of the month, we can guarantee that everybody will be very happy at home with their new ID cards, able to pick up their prescription drugs and go see their provider on, effective day one. Every day that goes beyond the 15th, and we'll certainly try our best to expedite as best we can, but every day that comes in beyond the 15th shifts that day of happy members off a little bit. We will accept business right up until the end of the month. However, you have to know, and the employer and the members will know that they're not going to be in the pharmacy system on day one. They may not have their ID cards until day 10. They'll be able to access their temporary ID cards through the HealthX portal, but not everything will be super clean with groups that come in for installation beyond the 15th of the month. Again, we'll still happy to accept them, but we will set the expectation with you and the group so that there aren't any surprises.
And because this is a differentiator, I think it's worth repeating. If the employer pulls out from the CBIA plan at renewal, will they still get the surplus?
Again, they will still get any surplus dollars that are owed to them. We will not keep their money. It's not ours to keep. Plain and simple.
Okay. Where does a member go to find out if a provider is part of their network? Where is the provider lookup?
So it's the Cigna National Network. So they can just go to Cigna. We have links on our website. Also in their HealthX portal, there's a link to the Cigna Provider Network from there. So there's a couple of different places that they can obtain that information.
Okay. Erin, is autism covered? So I know you talked a little bit about the mandates. Is autism covered?
So, that the autism mandate kind of gets a bad rap because of course, the medical services that relate to an autistic child are covered. What isn't covered is some of the other sort of services that an autistic child may require that aren't as medically necessary as others. So, for example, we've heard that there was a barn that autistic children could go and learn to ride horses, and that made them feel very happy and very free. Supportive services like that are not included. But the medical claims behind the autism, the diagnosis and treatment of those certainly are covered.
Okay. Erin, can you speak a little bit about the renewal and the timing? Will the renewal be sent out 90 days prior to the renewal? If not, then when?
Yeah, I believe at this point we are, again, it's a little early for us to be talking renewal. But I believe our goal is to have it 60 days in advance. We know for sure that the underwriting is really strong at 60 and becomes less strong at 90 and 120 days out. So I think we're going to gear towards keeping it at 60. I know that that's not a great answer for some of the larger group segments as those renewals do come out earlier. So we'll have to take a look at our block and determine whether or not most of our groups fall into that larger segment, whether or not we can, push those renewals out earlier, or if they're still kind of in that under 50 segment, we may stick to 60 days. Not a great answer, kind of a non-answer, but we're just maybe a month or two in advance of beginning those discussions with our stop loss carrier.
Okay. I'm getting the signal that we're going to wrap, but I've got one more question. Will
Okay.
CBIA keep the broker community informed on the progress and outcome of the Connecticut legislation?
Absolutely. Yeah, I mean, our website has all of the information on all of the bills. You can track bills, you can contact our legislature. Certainly, if we feel that there is something that we need you guys to be actively engaged on, we will let you know. Before we wrap, again, you guys, I just want to say, I know a lot of people, I've met with a lot of you, and everyone sort of just throws up their hands and rolls their eyes about the market and the situation that we're in right now. I cannot impress upon you enough. This is a real opportunity that we have here to make a difference and to show everybody, the market, the legislature, everybody, that we can make the right decisions and do the right things for Connecticut businesses. Thank you very much for your time. And I'll look forward to speaking with you all. If any of you have any additional questions, obviously feel free to reach out to anyone on the sales team. We're always happy to help. We're happy to come out and visit you and your team, help you learn more. Happy to go to client meetings, whatever you need. Thanks so much for your time.